This is Dr. Joe Kleber. I'm here at Ozone Medical, Ozone Clinics today. I'm here with Jennifer, the owner actually and founder of Ozone Clinics. And today we're going to talk about the PDO thread procedure. The threads have been around for actually a long time, quite a few decades. They fell out of favor for a while, but now they're back and they're a wonderful addition to aesthetics practice. And I've been actually using threads on my patients for aesthetics procedures for about 12 years. And they are dependent on, the success of those threads are dependent on the experience of the threader, if you will, or the practitioner, the quality of the threads. And here we only use FDA registered threads appropriately with the FDA that are actually approved for approximation, we call it, for lifting of sagging skin. Now, Jennifer's skin is in great shape today. So we're going to walk you through basic consult, how we assess a patient in regards to how well they will perform or how well the threads will perform. And that's dependent on the thickness of the skin, so and how much fat or how much subcutaneous tissue the patient has. We need to place that thread, what's in the subcutaneous layer, right above the layer right below it called the SMAS. And that's important because you won't get lifting if you don't place that thread effectively. And as I mentioned, it's the experience of that practitioner is really important to have an effective outcome and get really effective lifting. So what we do is, part of the procedure is, or part of the assessment for that patient is, we actually draw vectors. And vectors are extremely important also because the lifting or the angle of that lifting is very key to successful outcomes also. So what I'm going to do, I'm going to just show you a bit briefly how we would set up vectors. Now, we were going to ask the patient where she would really like to have threads placed, what the problem areas are. We've already talked about that. So we were looking at the lower face a little bit. And she's got a great jawline, but we can make it probably a little bit crisper by lifting a little bit more, a little skin there. The 90% of the threads I do actually are lower, we call them a lower face lift. And that's just a very popular area. Patients who are, now we're down to 35, 40 years old and up, and we have a really good outcome even in that younger age group, because we see a small amount of what's called ptosis, a drop or a sagging of the skin around age 40 or so. So now we're going to draw our vectors, and we're going to place these vectors we want to endeavor to lift this area right about here. And threads can be placed in either direction. They're called bidirectional. So if I place them here, we can lift this way. If I actually place them starting here and place the thread going back, because that's a really good vector, you can see how that's lifting. And we're going to place another one right about here. So if we lift and we just kind of test that out, we can see we're going to restore that really nice youthful look along the jawline and jowl. These threads will be placed through a small entry here and threaded along this the vectors that I pointed out. Then they're tied together, and then the actual little knot just disappears underneath the skin, and the thread is set in place, and we're done.